Hello, my name is Glyn Stevens and I'm here to talk to you about the Trilogy 202 non-invasive ventilator from Philips. And this is designed as a training module that's going to be sub-split into various sections so you can dip in and out of whichever section you feel relevant. So the first part is literally just to tell you what the Trilogy 202 is, what its intended use is, and a little bit about its technology. It has its own internal blower, so it's a very, very high flow device. Literally up to about 200 litres of flow per minute can be generated, and you have the ability to give controlled oxygen up to 100%. So I've actually just described a standalone CPAP device. So high flow, high oxygen, we've got a CPAP driver. Of course, its other intended uses for BiPAP, and this is equally licensed for invasive use as well, and it has familiar invasive modes, which will be touched upon in another module. So it is a CPAP, BiPAP and non-invasive ventilator. It's actually licensed equally to be used on paediatric patients as well as adults, and you can use it from 5 kilograms, so pretty much a baby, up to an adult. The technology. This part is really, really important and really useful, and it actually comes into play a little bit later when we look at the settings and how to correctly set those settings. Something called AutoTrack is the technology for this device, and it's in all the Philips devices. It does as it sounds. It automatically tracks a patient's breathing, and it does do that on a breath-to-breath basis. Now, so it detects when a patient breathes in and it breathes out, and it will do that in all the modes. So in BiPAP in particular, where it's delivering an inspiratory pressure, it needs to detect a trigger from that patient, then it goes up to the inspiratory pressure you've set, then of course it will detect where the patient is breathing out, and so it goes down to the expiratory positive airway pressure. How does it do this? Well, it does it breath to breath, looking for a draw of 6 mils from the patient. So that's all they have to do. It's a tiny, tiny little trigger from the patient, 6 mils. It's kind of like a teaspoonful of air. The machine then detects that and reacts up to the IPAP. It then detects their breathing out and very spontaneously, very quickly goes down to the EPAP. This is very important. It looks at the patient's breathing and responds to it. In other words, it will breathe in when the patient wants, and it will let the patient breathe out whenever they want, which is all under the banner of comfort. If the patient is in control of their own breathing, it'll be much more comfortable for them, so they should take to the treatment much better. The other part of AutoTrack, which at the same time, every single breath by breath, it's looking for triggers, it's also looking for leaks from around the mask. So we said earlier that it's got a very powerful internal blower, lots and lots of flow capability. Well, why not use that if we need to? So it's every single breath looking for leaks around the mask. So when it comes to the mask fitting, you simply do not need to have a really, really tight mask on this patient. You don't really need a seal around the patient, but if you do place the mask on gently and properly, and if it does create a seal, that's okay, but you don't necessarily need to have that. So leak coming away from the mask is acceptable up to a leak tolerance of about 60 litres of flow per minute. Could be leaking away from the mask. And the Trilogy 202, using this tracking technology, will detect that and compensate for it. So that's very important to remember, especially the triggering part, which we'll come back to in the settings.
Innovation and you. Philips.